Contrary to popular belief that arthritis is a disease of the elderly, in fact, 4 in every 5 people diagnosed with arthritis are under the age of 65. More than 350 billion people in the world today are affected by arthritis, and it's a leading cause of disability among the world population. Arthritis is all around us, but its impact is far greater than we can imagine. In the world today, almost 300,000 babies and children have a rheumatic condition, and a whopping 54 million adults have the doctors diagnosed arthritis. 30% of the working population is prone to rheumatism and arthritis due to the constant overworking of the joints and muscles through activities like standing for extremely long hours, driving for too long, exposing body parts that are linked to joints, ligaments, and muscles to a fixed position for a long period of time. Rheumatic diseases are characterized by inflammation that affects the connecting or supporting structures of the body, commonly the joints that sometimes are tendons, bones, ligaments, and muscles. Some even affect organs of the body, which can result ultimately to loss of body function. There are majorly 2 types of rheumatic diseases and arthritis. They are osteoarthritis. Osteoarthritis is a form of arthritis caused by the inflammation, breakdown, and eventually loss of cartilage in the joint, which causes the cartilage to wear down over time. With more than 1.5 billion cases per year in Nigeria, it is the most prevalent type of arthritis, destroying cartilage, which is the soft tissue that cushions the end of the bones within the joints. This type of rheumatic disease is more common in older than younger adults, and women are 26% more likely to develop rheumatoid arthritis than men. Osteoarthritis can affect any joint, but it occurs most often in knees, hips, lower back, and neck, small joints of the fingers, and the bases of the thumb and big toe. In normal joints, the cartilage covers the end of each bone. The cartilage breaks down, causing pain, swelling, and problems moving the joint. As osteoarthritis worsens over time, bones may break down and develop growth called spores. Bits of bone or cartilage may chip off and float around the joint, and in the body, an inflammatory process occurs and cytokines and enzymes develop, which damages the cartilage even more. In the final stages of osteoarthritis, the cartilage wears away and bone rubs against bone, leading to joint damage and more pain. Although osteoarthritis occurs in people of all ages, osteoarthritis is most common in people older than 65. Common risk factors include increasing age, obesity, previous joint injury, overuse of the joint, weak thigh muscles, and genes. 1 in 2 adults will develop symptoms of knee arthritis during their lives, while 1 of 4 adults will develop symptoms of hip osteoarthritis by age 85. The second most common type of rheumatoid arthritis. People with rheumatoid arthritis have immune systems that mistake the soft lining around joints to be a threat to the body, causing it to attack that area. As the immune system launches its assault, fluid buildup within the joint occurs, causing stiffness, pain, swelling, and inflammation. It is a chronic inflammatory disorder that can affect more than just your joints. In some people, the condition can also damage a wide variety of the body system, including the skin, eyes, lungs, heart, and blood vessels. Rheumatoid arthritis affects the lining of your joint, causing a painful swelling that can eventually result in bone erosion and joint deformity. The inflammation associated with it can damage other parts of the body as well. Severe rheumatoid arthritis can cause physical disabilities. Early rheumatoid arthritis tend to affect your smaller joints first, particularly the joints that attach your fingers to your hands and your toes to your feet. As the disease progresses, symptoms often spread to the wrist, knees, ankles, elbows, hips, and shoulders. In most cases, symptoms occur in the same joints as both sides of your body. About 40% of the people who have rheumatoid arthritis also experience signs and symptoms that don't involve the joints. Rheumatoid arthritis can affect many non-joint structures like the skin, eyes, lungs, heart, nerve tissues, bone marrow, and kidneys. Over time, rheumatoid arthritis can cause joints to deform and shift out of place. It is a relatively common disease. Approximately 1 in 100 people get it, and it's also devastating to a person's body if not treated properly. It is a disease process like cancer or diabetes, where the body's immune system mistakenly attacks its own healthy joints. The disease process causes swelling and pain in and around joints and can affect the body's organs, including the eyes, lungs, and heart. Rheumatoid arthritis most commonly affects the hands and feet. Other joints often affected include the elbows, shoulders, neck, jaw, ankles, knees, and hips. Within 10 years of the onset of the disease, up to 50% of people living with rheumatoid arthritis are work disabled if untreated, and related inflammation in the arteries result is an increased risk of death. The disease reduces the person's lifespan by as much as 12 years. Here are 7 symptoms that you should watch out for in order to prevent arthritis. Arthritis signs and symptoms may vary in severity, and they may even come and go, but once you feel these symptoms, ensure you go to the doctor for checkup. Severe pains and inflammation in the knees and wrist, stiffness in the joints, especially after a period of less activity, excessive muscle pulls, constant fatigue, fever and alarming weight loss, tender and swollen joints. When your joints and bones constantly shift out of place. Family history. If your family has a history of arthritis, then you should go for checkup regularly because it's also found to be genetic in nature.